Hello everyone, my name is Dr. Merlendi Brown. I am a family nurse practitioner and doctor of nursing practice, and I am coming to you all on today with a very informative video entitled 5 Ways We Can Reduce High Blood Pressure. So before I actually jump right into the video, I want to say thank you all for joining me on my channel on today. I know that with YouTube there's so many different channels, so many different videos and content that you can choose to engage in and enjoy. So the fact that you stopped by my channel on today and decided to listen to my content and the content that I've put out, I want to say that I really appreciate it. So if you wouldn't mind doing me a favor and subscribing to the video as well as liking the video, I would greatly appreciate it. And if I'm not mistaken, when you subscribe to the video, then you will actually receive notifications each time I actually come on with the video, so that you'll stay up to date and informed on the content that I upload to YouTube. So for those of you all who do not know, I actually started a YouTube channel probably about a couple of weeks ago with the goal of providing healthcare education, and then I'll have a special emphasis on nursing and nursing education as well. Of course, I'm a family nurse practitioner, doctor of nursing practice, so I've journeyed through multiple nursing programs, and of course I actually provide healthcare education on a daily basis, and so I thought it would be just a great idea to actually provide some of that information to you all, the public as well. So hopefully you all, like I said, enjoy the content that I have for you all on today, and we will jump right in. So hypertension, which is high blood pressure, is a very common disease process that we actually see in the primary care setting. I would say that's probably the number one disease process or chronic condition that I treat on a daily basis. And for those of you who may wonder what is high blood pressure, it's just pretty much the way that it sounds. It's pretty much the tension and the force that's exerted on blood pressure, or the blood vessel, shall I say, blood vessel walls. So whenever there's an increased amount of force or increased amount of tension on those blood vessel walls, and it can cause so many different complications. So individuals who have high blood pressure, individuals who have been diagnosed with hypertension, they are at risk for hypertensive retinopathy, so blindness and visual disturbances. High blood pressure contributes to heart attacks, it contributes to strokes, it contributes to kidney problems, end-stage renal disease. So there's so many aneurysms even. So there are so many complications that are secondary to high blood pressure, more so uncontrolled high blood pressure. So I am an individual and I am a provider, healthcare practitioner that truly believes in informing patients and giving patients the tools that they need in order to adequately manage their chronic condition, whatever it may be, whether it's high blood pressure, whether it's high cholesterol, whether it's hypothyroidism. I truly believe that patients should be equipped with the knowledge and the tools that they need so that they can adequately manage their condition, even in, their home setting. Of course, it's great to come to the doctor every month or every couple of months to make sure everything's going well, but I want to make sure that you have the tools that you need, so whenever you go home and you're at home for those few months in between actually seeing your healthcare provider, that you know what you need to be doing on a daily basis in order to adequately manage your condition. So if you have high blood pressure, if you know someone with high blood pressure, then I believe this video will be for you all. So first, very first thing that I always tell patients is, number one, follow the DASH diet. And DASH is actually an acronym, and it stands for Dietary Approaches to Stop Hypertension. So follow the DASH diet, Dietary Approaches to Stop Hypertension. And I'll make sure that I put a link in the description box, in the YouTube description box, so that you can have direct access to like a sample DASH diet meal plan. But pretty much this particular meal plan just emphasizes the importance of eating fruits and vegetables. So an individual, really anyone in the population really can do this as well, but particularly individuals who have high blood pressure, the recommendation is to consume 4 to 5 fruits per day, 4 to 5 vegetables per day, whole grains, about 6 to 8 whole grains per day, consume low fat or non-fat milk as well. And also, which is super important, is sodium intake, not to do any more than 2,300 milligrams of sodium per day, not to ingest more than 2,300 milligrams per day. So that is the recommendation. Really more so between 1,500 and 2,300 milligrams of sodium sodium is the recommendation. Of course, if you do 1,500, that's even better, but no more than 2,300 milligrams of sodium per day. So of course, sodium is almost in everything that we consume, particularly like carbonated beverages and sodas, and I always tell my patients to kind of watch out for the smoked turkeys and the hams and potato chips. Those items in particular are very, very high in sodium. So just be a little bit more aware of those nutrition facts, and looking on the back and seeing like how much sodium is in this product that I'm about to consume, and make sure you kind of add that up through the day and make sure it does not exceed 2,300 milligrams. Now, I will say, if your doctor has given you a more strict diet as far as milligrams that you should follow per day, then definitely follow what your doctor has recommended. But if your doctor hasn't said anything, or you're just kind of curious as to what the dietary restrictions are with regard to sodium intake, then it is 1,500 to 2,300 milligrams per day for individuals who have high blood pressure. So secondly, after following the DASH diet, I would recommend exercising on a regular basis. So this can be a little bit difficult, of course, to do, especially if we're super busy. We work every day, you know, by the time we get home, we don't really feel like exercising, but we really do need to make this a priority in our lives. So the recommendation, particularly for individuals who have heart concerns or who have high blood pressure, is to exercise at least 150 minutes weekly. So that is equivalent to about 30 minutes per day, 5 days per week. And that's moderate intensity exercise. So that's brisk walking. So I always tell patients, if you have like a trail in your neighborhood or whatever the case may be, of course, you know, do all this safely. But if you have like a track nearby, to make sure that you kind of engage in that brisk walking if you can. If you're an individual and you can engage in vigorous activity like running, things of that nature, then you can actually do a little bit less per week. So the recommendation, if you're going to do vigorous exercise like running, then you can do 75 minutes per week. And so that's equivalent to about 15 minutes per day, 5 days per week. So that's vigorous exercise like running. But if you're just going to do some brisk walking, then you definitely do 30 minutes a day, 5 days per week. And that's equivalent to about 150 minutes per week. So yes, so exercising is super important. Number 3. Stop smoking. If you're someone that engages in nicotine use, or you use tobacco products, of course the recommendation is to stop. I know that it can be a little bit difficult. Of course, if you've been an individual who has smoked for years and years and years, you know, just saying stop smoking, you know, it's sometimes easier said than done. So if you are at a point where you really feel like that you can, you know, you're really, really ready to quit smoking, then definitely visit and talk with your primary care doctor about some smoking cessation options that are available. There are some medications that your primary care doctor can prescribe to actually help and aid you in stop smoking altogether. But of course, you need to know what's available to you. So the first step definitely will be to talk to your primary care doctor about what you can do. If you're someone that does not smoke, then congratulations, because that's definitely you know, puts you in a much better position as far as, you know, lowering your risk for developing any complications secondary to high blood pressure. So awesome there. Number 4, limiting alcohol consumption. So I don't promote, of course, alcohol use whatsoever, but I understand that individuals, so many individuals in the population choose to consume alcohol. So if you are an individual who chooses to consume alcohol, then the recommendation is no more than 2 drinks per day for males and no more than 1 drink per day for females. And I'll say that again. So the recommendation is no more than 1 drink per day for females and no more than 2 drinks per day for males. And so alcohol, there's the research is a little bit mixed on, you know, how much is too much and all of that. I think there's a general consensus about no more than 2 for males per day, no more than 1 for females per day. But it's more so when an individual consumes alcohol in excess is really when we begin to see the elevated blood pressure issues. So I would follow that regimen that I outlined there, okay? And then lastly, reducing stress. That is so very important. Stress actually releases a lot of chemicals in our bodies that can actually put us more so like in a fight or flight mode, and eventually cause vasoconstriction, which is decreasing of the blood vessel, like the diameter of the blood vessel. So anytime you decrease or cause vasoconstriction, the blood vessel, if we look at this as like a blood vessel here, whenever an individual is stressing, particularly if it's long-term stress, when individuals is engaging in any type of stress or smoking, that blood vessel wall goes from like a nice normal diameter, and it actually decreases. And whenever the blood vessel wall decreases or it constricts, shall we say, then all of that pressure inside of the blood vessel, it actually puts so much stress and force on the walls, and that's when it causes all of the damage and puts an individual at risk for the complications that I mentioned above. So definitely, if you're an individual who struggles with anxiety or struggles with stressing, you're an individual that tends to stress a lot, then I definitely would recommend engaging in some coping mechanisms. So I always tell individuals you can consider walking. Exercising is really good to reduce stress. If you have a very good support system, that's actually very important as well, to talk to individuals, whether it's your wife, whether it's your husband. Talk about some things that are stressful. Sometimes just talk therapy is really good as well. If you feel like that you need counseling, definitely reach out to your healthcare provider, and they often can refer you to a counselor, to a psychologist, or to a psychiatrist who can help you in that regard. And I always say too, if you're a person of faith, I mean, definitely that's what I do myself, is to just really give my problems and issues to the Lord, and realize that He didn't really put we're not equipped to really handle stress. That's why our body kind of breaks down the way that it does whenever we're stressed out, especially on a routine and continual basis. Our body really can't handle it. That's why we go into this fight or flight, and we have all of these different reactions. So I realize that, and the Lord knows that we can't really sufficiently handle it ourselves. So I always even tell my patients in the clinic, if you're someone that prays, you believe in the Lord, you pray, which I encourage you to do so, definitely cry out to the Lord and ask Him to take whatever burdens or stresses that you may have, and ask Him to deal with it and give you the peace that you need in order to move forward in your life. So that's all that I really had for you all on today. I hope that you all found this video to be helpful, that you found it to be informative. Again, 5 ways to reduce high blood pressure. This video more so is for individuals who are struggling, who have struggled with hypertension. 5 ways to reduce blood pressure. Exercise, right? 30 minutes a day, 5 days per week, engaging in moderate intensity exercise, so like brisk walking, following the DASH diet, dietary approaches to stop hypertension, stop smoking, limiting alcohol consumption to no more than 2 drinks per day for males, 1 drink per day for females, and then lastly, reducing stress and just finding coping mechanisms that work for you, so that your body won't continually produce those chemicals that are going to increase your blood pressure. So like I said, I hope that you all enjoyed this video. If you have any other content ideas for me, if there's any other disease process or anything like that that you want me to talk about or discuss, you can definitely leave it in the comment section below. Again, if you haven't already subscribed, I ask that you would please subscribe to the video, as well as like the video as well, and I would greatly appreciate it if you were to do those 2 things there. So thank you all for watching, and until next time, God bless. Bye-bye.